So a vascular interventional radiologist is a subspecialist trained in imaging and using imaging to perform minimally invasive surgical procedures. Now, these surgical procedures can be performed either through blood vessels with pinhole incisions or direct pinhole incisions through the skin to perform many of these procedures that used to take larger incisions with surgery. We treat many conditions with pinhole-sized incisions in order to allow for faster recovery, faster healing, and reduce hospital stay time. Most of the time, usually the same day discharge. These conditions include peripheral arterial disease, which is blocked blood vessels, deep venous thrombosis, blood clots in the veins, or clots that travel to the lungs, which are called pulmonary embolism. We also perform procedures on aortic aneurysms, abnormal growth of the major artery in our blood vessel that's basically ballooning and has a higher chance of rupture. We can treat that minimally invasively with a stent. We also treat major processes such as cancers in the kidney, liver, lung with minimally invasive procedures. Peripheral arterial disease is blockage or narrowing of blood vessels when fatty deposits build up in the arteries, reducing blood flow to the legs. It's very common, affecting about 8 to 12 million Americans, although those numbers are probably higher now due to a lower rate of diagnosis. 75% are not getting treated, which is more than cancer, stroke, and congestive heart failure. This condition can cause leg pain, numbness, wounds in the legs, and potentially serious complications such as non-healing ulcers and even amputation. So if left untreated, peripheral arterial disease can have significant impact on a patient's quality of life. We assess patients for lifestyle-limiting pain on walking or pain at rest when even they're resting, or wounds that are not healing. So we perform imaging tests to see what exactly is contributing to these processes. Some of these imaging tests could be performing an angiogram to place a stent or angioplasty of the blood vessel. So if you have peripheral arterial disease, you may have pain on physical activity, which is called claudication, such as walking down a certain number of steps. Other symptoms include leg numbness or weakness. Sometimes patients get sores in their feet or legs that won't heal, or a change in the color of their legs. Some other symptoms are hair loss on your feet or legs, and the signs are pulses that are weak or absent in the legs. Sometimes men can have erectile dysfunction, similar to processes that are happening in the legs. So an aneurysm is a disease or condition that causes weakening of the wall of a vessel, causing it to become either very large or just balloon out. This weakens the wall, and at a certain point, it increases the chance of rupture and bleeding that at times could be life-threatening. So an abdominal aortic aneurysm occurs when in the area of the aorta, the large vessel in our body, either in the abdomen or the chest, becomes very large and balloons out. We treat most other organ aneurysms of brain or other organs with either coil embolization, where we block the aneurysm without blocking the major vessel, or a stent graft, where a small metal cage that is covered is placed across the aneurysm so blood will flow only through that stent and not through the weakened, ballooned out segment. So this will ensure that the vessel will not continue to expand and rupture. In an aortic aneurysm, so this is the large vessel in the body, these are usually treated by a stent graft. So this requires a very short hospital stay, and we determine that on a case-by-case basis with our multidisciplinary team. And that way the blood flows just through the stent graft and not through the weakened blood vessel that's causing it to rupture. Blood clots in the veins are different. We either treat them either with medication or catheter-directed intervention. So small catheters can perform vacuum suction, take out the clot, or lysis, drip medication so it can break down the clot. Sometimes the veins are narrowed, so we place a stent to keep them open. In a pulmonary embolism, these clots have traveled to the lung, causing strain on the heart. So in a similar fashion, we take a small catheter up there to vacuum suction the clot out, relieving that strain on the heart. Yes, at times we do procedures to close down blood vessels, the opposite of opening up that we just described. So that process is called embolization. We use that to treat many conditions instead of performing major invasive surgery. That way we have the same results with less risk and faster recovery. Some of these examples are treating uterine fibroids without surgery, enlarged prostates, varicoceles, knee pain from arthritis, plantar fasciitis, hemorrhoids that are bleeding. These all can be treated by blocking those blood vessels. So fibroids are benign, non-cancerous tumors which either developed on or in the wall of the uterus. So they're made of dense fibrous tissue, but they're fed by these blood vessels that are abnormal. So most common benign tumors in the tumor are these fibroids, and they are clinically relevant about a quarter of the patients aged from 30 to 50 years. There are different types of fibroids. There are various parts of the uterus. Intramural fibroids are the most common. They're in the actual muscle wall of the uterus. And as they get larger, they can cause increase in menstrual bleeding, pain during menstruation, just pelvic pain, back pain, or pressure on the bladder or the rectum causing urinary symptoms or constipation. Subserosal fibroids are the second most common. These are on the outer wall of the uterus. They usually do not affect menstrual flow, but they do cause pelvic pain, back pain, pressure, the urinary symptoms, and sometimes constipation and bulkiness, which is causing pain in the belly. Submucosal fibroids are the third type. They cause prolonged periods and heavy periods, even if they're small. As I described, uterine fibroids are varied in the type of symptoms they present. Heavy, prolonged menstrual periods are usually the symptoms that they present with, usually with the monthly bleeding, and sometimes they can occur with clots or passage of tissue, which can cause anemia. Increased menstrual cramping, pelvic pain, discomfort in the pelvis, pain during intercourse, pain during the blockage of urine flow. So all of these are symptoms that can happen with uterine fibroids. So the fibroids are usually diagnosed either by physical examination by the gynecologist or your primary care doctor, or more commonly with an ultrasound or MRI. In regards to treatment options for fibroids, treatment could be conservative, such as medication, hormone replacement therapy, hormone alteration therapy, or surgical, which involves myomectomy, taking out just part of that uterus that's located with the fibroid, or a hysterectomy. However, there are non-surgical options, such as what interventional radiologists will do, that include embolization, knocking off the blood vessels that supply these fibroids, but preserving the uterus. In general, the embolization procedure is performed when the patient is conscious with sedation, drowsy, but feeling no pain. A small opening, about 1.5 millimeters, is made in the groin, through which a thin catheter is inserted through the artery, and the catheter is guided under X-ray imaging into the blood supply of the uterus, while the radiologist is watching how it's progressing using an X-ray. These tiny microspheres, the size of grains of sand, or probably less than grains of sand, are used to block the supply to the fibroids, cutting off the blood flow. And usually it's done on both sides, basically taking off all the supply to the fibroids, but the surgical approach is that way mitigated. So the recovery is usually the same day. We send patients home to resume their normal daily activities in approximately 2 to 3 days, and most patients are back to work within 3 to 4 days. Adenomyosis is similar to fibroids. However, it's a little different in the fact that it's related to ectopic endometrial tissue in the actual muscle wall of the uterus. It's a common benign pathology associated with heavy and painful menstrual periods. Patients can have pure adenomyosis or combination with fibroids. The treatment option for adenomyosis is similar with medical or surgical options including hysterectomy, or non-surgical options, which is what interventional radiologists do, which is embolization. Other processes, such as prostate embolization, prostates can be enlarged, causing urinary symptoms, weak stream, incomplete emptying of the bladder, or even patients can become catheter dependent because of bladder outlet obstruction. So we use embolization to block the blood supply to the prostate to cause it to shrink without surgery. In regards to knee pain, patients may have arthritis but yet not be a candidate for knee replacement, or have other conditions like obesity, heart disease, lung disease that may make them high risk for surgery. These patients often do extremely well with embolization, which is blocking the blood supply to the vessels that are causing inflammation of the knee. Pelvic congestion is a condition that affects women that's basically varicose veins of the pelvis, causing dull, chronic pelvic pain, and it's often missed or misdiagnosed. It often worsens after standing for long periods of time, before menstruation, during or after sexual intercourse, or late in pregnancy. Some patients experience painful menstruation, back pain, hip pain, abdominal tenderness, and occasionally swelling of the vulva or vaginal area. These are treated very minimally invasively with embolization, basically a procedure blocking the bad veins that are refluxing and contributing to engorgement of those pelvic veins. We call it gonadal vein or ovarian vein embolization. It's a very minimally invasive procedure. It's an alternative to major surgery such as hysterectomy. Yeah, in the same vein, no pun intended, male varicocele embolization can also be done without surgery. This is very helpful for a process such as male infertility, pain such as testicular pain or scrotal swelling, where we block off the blood vessels that are refluxing, causing those varicoceles and swelling in the scrotum. So a lot of the procedures I described, it's important that they may not be available at every institution. So there may be an interventional radiologist available at some institutions, but some institutions require highly specialized training or infrastructure. In our region, we're the only institution that has most of the infrastructure and expertise, including the personnel trained to perform these procedures. For example, the aortic interventions, the peripheral arterial interventions, the detailed cancer interventions are only available in the region at Mercy Vascular Interventional Radiology.